All right, good afternoon. We will call the Health and Human Services meeting to order. Madam Clerk, roll call, please.
Each member is acknowledging that they are attending the meeting via Zoom and that they are located in Wayne County, Michigan, unless otherwise stated when I call your name. Commissioner Marecki has requested an excuse. Commissioner.
Did you say Commissioner Dobb?
Yes.
Here.
Commissioner Anderson.
Present.
Commissioner Killeen.
Here.
Chair Baker McCormick.
Here.
You have a quorum present.
Next item, please.
B, Chairwoman's remarks.
I have none today. Thank you. Next item.
C, approval of the August 24th, 2021 meeting minutes.
Is there a motion?
Move approval, Madam Chair. Somebody else didn't.
Okay, it's been moved and supported. All those in favor?
Aye.
Aye.
Any objections? Any abstentions? If none, motion passed. Next item, please.
D, unfinished business. There is none listed.
Okay, next item.
New business.
Are you going
and
to?
So we'll have an update, the COVID update, and then if there's any public remarks, we'll have them after. Do we have Director Jordan for the update?
Good afternoon, Chair Baker McCormick. Can you see me? Yes. My name is Carolyn Baker, and I will be presenting for Director Jordan today, who is responding to the emergency response in Flat Rock.
Okay. And please give your name and title for the record, please.
Certainly. Carolyn Baker, Chief Operating Officer here for the Department of Health, Human, and Veteran Services.
Thank you, Ms. Baker. Go right ahead with your COVID update, please.
Okay, Madam Chair, am I able to share my screen today? I have a presentation. If not, I can present it and share it later.
Madam Clerk, can you allow her to share the screen?
Yes, you can share your screen.
Okay, thank you. Okay, so this is the presentation for our COVID-19 update for the reporting period, August 29th through September 4th. And let me see if I can do a slideshow here. Okay, can you see my screen?
Yes, we can.
All right, thank you. Okay, for new cases, over the past week, there was a total of 1,342 new cases reported and 11 new deaths. So this is a 5% decrease from the previous week when we reported 1,407 new cases. On average, the average daily case reporting is 192 new cases per day. We are seeing over the past few days a downward trend, and looking at the data, perhaps slow testing over the holiday weekend, but we are closely monitoring the trends over the next few days. So this shows our COVID-19 cases from the beginning of the pandemic. And as we can see, a slight uptake that over the past six weeks, we've been seeing an increase in cases. And as I just stated, over the past week was the first time we've seen a 5% decrease since that July 4th weekend. So one thing we're looking at is, every time there's a holiday weekend, we want to monitor cases very closely to see if there's an uptake, just due to folks being outside and gathering. Cumulatively, I'm going to go back here. To date, in total, we have had 109,705 cases in total and 2,572 deaths since March 2020. As far as our COVID tests, cumulatively, we've administered in the county 1,744,907 COVID tests. Over the past 2 weeks, our average test per day was 2,827 tests per day, compared to the state of Michigan, which was 2,615 tests per day, and compared to Detroit, 2,310. So Wayne County is still testing on average slightly higher than the state in Detroit. All right, this shows our percent positivity, and this is a trend over the past 4 weeks. And over the past week, we did see a slight uptick in the percent positivity in Wayne County compared to the state of Michigan, 10.5% positivity, and then Detroit, 5.5%. And so again, as I stated, we'll be closely monitoring this percent positivity over the next few days to see if there's any effects from the holiday weekend. So based on this percent positivity and based on the CDC risk threshold, we are now, based on the percent positivity, substantial risk. And so again, week by week, we're seeing these changes. This is the new daily cases per 100,000 population. And over the past week, we did see from the 8th of August through now, we did see a slight increase, but along with the new cases, this week we observed a rate of 135 per 100,000 population. And this is also compared to the state, which is at 158 per 100,000 population, and in Detroit, 82. And based on this indicator, the CDC risk threshold places Wayne County at a high risk for community transmissions. Okay, looking at the jurisdictions, and this is the municipalities, actually. Let me pull my talking points here. So we are seeing the top 5, Dearborn has 14% of the cases. And this is a decline from the previous week. We did see a 1% decline in the total cases from Dearborn. This is followed by Canton. Canton has 8% of the total cases. And then Livonia, also 8%. And then Dearborn Heights and Westland. Overall, the Alpha variant is the largest variant of concern that we've detected through the genome sequencing that the state does for all of the counties. However, over the past few weeks, we have been seeing an increase in the Delta variant. So just between the previous week and this week alone, we have observed 70 additional Delta variant was detected in Wayne County. So, and we've been seeing that consistently week to week. We've also reported 9 new cases of the Alpha variant over the past week. So looking at vaccine coverage, right now we are at 68.8% for those who received 1 dose, and then fully vaccinated 62.8%. We're seeing the highest vaccination rate among those that are 65 and older, 88.6%, and then 84.2%. And then for those 12 through 15 years of age, we're seeing the lowest vaccination rates here. So we are looking at this data to identify areas of opportunities. We are actually actively reaching out to schools and scheduling vaccination days and events. And we have already started to do that work over the past week, and we plan to continue to do that throughout the weeks to come. Looking at the vaccination rates within the region, the state of Michigan here, 60.7% for those 12 and older that have received the first dose, and then 56.1 compared to out Wayne County. We also have Washtenaw and Oakland here that are 71.5 and 71.6 for those who's received 1 dose. And then compared to the city of Detroit here for the 1 dose, 43.4, and fully vaccinated 35.7. This is describing our breakthrough rates. So to date, we have, for the county, there's been 2,340 breakthrough cases reported. And of those that have been fully vaccinated, this still makes up less than 1% of those who are fully vaccinated. Deaths, 33 deaths we observed, and hospitalizations, 70 hospitalizations. And then of those breakthrough cases that have been screened through genome sequencing, 93 of those cases were detected for the variant of concern. This is very small, but this is sharing what our efforts with our in-home vaccinations. So to date, we have administered 304 vaccines using our in-home program. So overall, Director Jordan did want me to share this information about national vaccine ranking. So for the state of Michigan, the CDC does have this data that shows where states are positioned for those who are fully vaccinated or received 1 dose. And for the state of Michigan, Michigan ranks 26 in the nation for the percentage of those 12 and older that are fully vaccinated. And we rank 28th. Michigan ranks 28th for those with the, let me see here. Okay, yeah, so 26 in the nation for those who are fully vaccinated in the nation. Okay, so overall, looking at our data, we did see an increase, in those who are interested in getting vaccinated. We are seeing the vaccination rate increase from week to week. Some age group in some areas more slowly than others, but we are seeing this change in our data. We did observe for the first time over the past 6 weeks, a decrease in the number of new cases reporting each week. Again, we started to see that increase after the July 4th weekend. And so this weekend, we are really paying some close attention to the data to see if there's any uptakes based on that. One thing we're also observing is that schools start this week. And so just based on students being in close spaces, we're looking at that data as well. And also wanted to share that week to week, we report increase in reporting of the Delta variant. So over the past week, 70 new Delta variant cases were reported from the previous week. So that will conclude my data presentation for today.
Thank you. Thank you, Ms. Baker. The mask mandate that was put into effect, I believe that was about a week ago. What is the feedback that you're getting from the school districts? If any?
Yes, the feedback has been overwhelming. We have received thank you from those who are in education. So it's been positive. We have received and we have received some feedback that some parents are not in agreement with the mask mandate, but overwhelmingly, I would say it's been more of a positive response than one that is opposing to the mandate.
And the vaccinated versus those that are unvaccinated, you reported that there were 33 deaths. Do we know whether they were vaccinated or unvaccinated?
Okay, so I think you're talking about the breakthrough data.
Yes.
Okay, the breakthrough data, those are vaccinated. So of those, as we know with vaccines, there is a risk of breakthrough. And depending on the technology of the vaccine, you may get a 99% effectiveness, 95% effectiveness, and the data is very clear about how effective these vaccines are. So based on, and this is what you're talking about here, the breakthrough data. So yes, what we found of those who are fully vaccinated, which is the 564 and 7 cases, there were 2,340 of those that actually had a positive case after they were fully vaccinated. And of those that were positive, 33 deaths occurred. I guess to answer your question, this will be the very definition of breakthrough, meaning those who have been vaccinated but still were exposed and detected to have COVID.
Is 33, that's the number.
Of deaths.
Okay, of deaths, okay. I just wanted to clarify that, thank you. Mm-hmm. And how about positive cases for children? Are those numbers included anywhere or do we have them?
Yes, we do. So we did not include this in this presentation, but we do have the ability to look at positive cases for children. For example, the last presentation that Director Jordan shared, she shared the mode in our data, and last week was the first time we were seeing more 11-year-olds in our data. So we are looking at our cases per gender and by age. So for this period, the mean age of our case load was 36 years of age, and our mode was 29 years of age. But we are looking at our data and stratifying it by age groups so that we can identify, those areas that we need to focus our efforts as well.
Okay, so you don't have the full analysis of the data. Is that what you're saying for children?
Not for today, not for this presentation, but we are we do have the capability of being able to provide that data.
Okay. And also do you foresee that there will be a mandate to be vaccinated in the county of Wayne for county employees?
I do not have that answer. So I can't answer that, and
Okay.
Yeah, yeah, and I'm thinking whether there's been discussion, and no, we have not discussed that yet.
Okay.
Mm-hmm.
And the last question is that I have anyway is in reference. Well, you know what? I'll come back around to this question because it's a total different subject matter.
Okay.
Let's start with Commissioner Dobb. She has a question.
Okay.
Thank you, Madam Chair.
Mm-hmm.
Ms. Baker, I just wanted to check on the status of our program to give out the third dose, the booster shot, to anyone who, to the non-immunocompromised people. I know we're giving out to immunocompromised individuals right now. Is there any update on when we'll open it up to everyone else?
Yeah, so we are gearing up. We're always trying to be proactive in planning. And one strategy our key strategy has been alignment with what the federal government is doing and with the state so that we are able to communicate, share best practices, and deploy on a single plan. So the CDC has not provided any clear guidance as to when we should begin. I know that we are looking diligently each and every day for research and for information coming down. So that's been our key strategy, alignment with the state, alignment with that, so that we are able to coordinate resources, and we have not received guidance for the booster for non-immunocompromised yet.
Okay. All right. I just wanted to check in on that. That's all I have. Thank you. Thank you, Madam Chair.
Thank you, Commissioner Dobb. Commissioner Anderson.
Thank you, Madam Chair. Just a follow-up question. I have a couple of other questions, but there's a follow-up question I have. I know she mentioned the breakthrough infection rate in those that had not survived. But I wanted to ask, what percentage of the positive tested and hospitalizations and deaths are related to not being vaccinated, period?
Well, so I would actually approach this backwards. And for this presentation, we do not have the week by week. We do not have the week by week breakthrough cases. We've been providing it cumulatively. So what I would do is look at those new cases and subtract the breakthrough from those cases. Just based on data, it's showing well over 95% of those. And if we're looking at 1% of our cases being breakthrough cases, then the difference will be 99%. So that's just pure logic. And this, is reported to us. This, as far as the breakthrough cases, is reported to us, and we're able to then be able to look at our new cases. So that would be my answer to you. So if 1% of our cases are breakthrough cases, then the 99% would be of those who are unvaccinated.
Okay. All right. I guess that works. I just would have thought that they would have hard numbers for that, but I understand. I did want to ask also about the MU variant. I don't know if it's pronounced.
Yes.
And if you could give us an update on that, and do we have that in Wayne County yet?
Yeah, so we've been following that. I know that the World Health Organization has been paying close attention to the mu virus, just based on, and there's challenges with genome sequencing here in Michigan. We know that, we have 2 labs in the state, and they're only able to look at just a portion, a small sample of our data. That's why we don't have large findings of our variants. But to date, we have not observed, or at least they have not reported any new cases in our data. And even in looking at the CDC, I think that data is very limited. So if we were to explore that a little more, we'll have to look at the trends in the nation. And I don't have that information right now at hand. It's just a matter of doing a quick search. But for Michigan, specifically Wayne County, there's been no report of the new cases, but we are watching that.
Okay, and can you tell us the transmissibility of that or communicability of that variant versus the ones we've dealt with so far?
Yeah, so I would say for the purpose, maybe the next time, just doing a little more study on it since it's of interest. As you ask these questions, this gives us more insight as to the sort of information that you're looking for. So definitely we'll do some study on it and get back to you, especially looking at if there's any cases in Michigan that's been reported, so that, or even close in the region, so that we are on the alert for that.
Okay, thank you. I appreciate that. If we could get that in the future at the next meeting, maybe. I also wanted to ask, has the county website been updated for testing sites and vaccination sites? Someone reached out to me a week or so ago and said a lot of them were not testing any longer. I'm concerned about all of Wayne County, certainly, but it seems when I looked on the site, most of the locations for testing were in the city of Detroit, not out county. And I'm not sure if that's a mistake or if that's, if I'm mistaken. But I believe Garden City Hospital is still doing them, but I don't know which ones are doing them and not charging for it if someone doesn't have medical coverage.
Yeah, and you're right. We do have, I would say, our vaccine information is current on the website. That's been our strategy, our priority strategy for this period. And we are aware that some of the information on the website is outdated, and we are updating that as it relates to COVID testing. And we are working to update that over, the next few days.
Yeah, I would hope that you would think, as fluid as things are, that every week that someone would be looking at that page to see how current it is. And but I appreciate the response. Thank you.
Yep.
Thank you, Madam Chair.
Thank you, Commissioner Anderson. Vice Chair, Commissioner Killeen.
Thank you, Madam Chair. And welcome to committee, Ms. Baker. Thank you for the presentation. I got a couple of questions on the positivity rate. For future reports, Ms. Baker, since you do have the data, could we get like a distribution graph of the ages of who's testing positive? It's something a lot of people are talking about, and I think just to have that, and I think graphically is better. I don't want to see a spreadsheet with a lot of data, but just graphically, I think that would be helpful for the discussion. But I do have one question, Ms. Baker. What use to public health officials and hospitals is the positivity number? Why do we keep that?
Yeah, so we look at 2 indicators for public health response. One is the positivity rate, and one is the rate per thousand, the case per thousand population. And so the positivity rate just gives us some ideas about, there could be selection bias with positivity rate for those who are concerned, or they have to work, or they may be experiencing symptoms or may think they're exposed. And positivity rate gives you that the information you need that would describe the testing capacity, and of those who are testing, you know, what is the severity of illness within those who are testing. So it does give us some information as to this group of this population group, and you know, the severity of positivity or exposure within that group. Whereas the cases per 1,000 population controls for, you know, the speed of that disease within that population. And so we're looking at both. And so, yeah, so the positivity, as you stated last time, it does indicate give some idea about potential capacity. You know, hospitals may look at that and say, okay, the positivity rate is going up, and based on the etiology of this disease, we're seeing that of those that are positive, we can look within this population.
All right, be careful, honey.
Hello?
Glenn, you got to be on mute.
Uh-oh, sir.
Oh.
Thank you.
Yeah, so it gives us some idea to plan, to forecast, you know, as you mentioned, again.
So they tell us where we're going.
Yeah, it does. So we look at both. And
well, let me ask you another question on that then, Ms. Baker, because, you know, I have tracked this very carefully right from the start. I drag around a BS in biology with me. I know how viruses operate. Mm-hmm. What I had been hearing from health experts 4 or 5 months ago was when you hit a 5% positivity rate, that's when alarm bells start going off. I asked Director Jordan about that 2 weeks ago, and she was like, well, 5 to 7 is kind of, you start creeping above that and you have a real problem on your hands. Well, now we're looking at numbers like 8 and 10. And as positivity rates keep going up, doesn't that tell us that more people are going to be going to hospitals and that the spread is increasing? Isn't that what those numbers tell us?
So as an epidemiologist, and we share that, one thing I would say is that the novel coronavirus, as we learn more about it, right. So I wouldn't just look at the positivity rate, right? So one thing we're seeing over time is that death is decreasing, has declined. Fatalities due to COVID-19 has declined significantly. Even hospitalizations have declined significantly. We over the past few weeks, even as we observed increase in cases, there's something that's happening in the environment that we're not seeing the rate of hospitalizations or the rate of fatalities as we're seeing compared to the beginning of the pandemic. So as we change and we learn more, and you know, we find more innovative ways to respond to COVID, then some of these thresholds and how we responded based on the threshold, we have to adjust. And I think that's what's happening at the national level. So at the beginning, they did provide us with these benchmarks and said, okay, with this is what you do. But at the CDC level, and that's why we're bringing those thresholds to bear right now. We're adjusting and we're pivoting based on the science. So it is of concern. You know, we are responding. We are looking at strategies such as, and we're responding to the changes in the environment too. As you know, children are going back to school, students are going back to school. We're seeing increasing, right. So we are responding in that way.
Well, and I think you made a very good point there that gets lost a lot of times in this. The virus is still teaching us. It is still giving us curveballs. It is still new things are appearing. Maybe it's the move, maybe it's not for the future. But I think we're still in a learning curve with this virus and how to deal with it. And so I think that's another important message when we're talking about being cautious out there in terms of, I really appreciate your answers, Ms. Baker. Thank you, Madam Chair.
Thank you, Vice Chair Colleen. Okay, so it looks like someone from the public has their hand up. We will take public comments very shortly. One other question that I had, Ms. Baker, is just very briefly, if you, for those that are on the line concerning Flat Rock, just a very brief, if you have the information, I don't know if you came prepared, but just to give us a overview of where we are with the Flat Rock situation.
Okay, and thank you for mentioning if I came prepared, because I'm holding down the home front, and we have our COO, County COO, Janelle Allen and Melita Jordan, who are, you know, on ground. They're sharing as much with me, but one thing I can share is that it is a collaborative effort. We have working in partnership with the city, the mayor, his team, the EPA, the state of Michigan, and just responding, making sure that we're working on communication to the residents there for those who need to evacuate. Ford also is on ground. We did have a town hall meeting, which was really effective, where we had a representative from Ford, as well as the mayor, that, you know, they shared the information with the residents and was able to answer some questions right there. So we are, based on those questions, are putting together some frequently asked questions and making sure that we're updating residents as frequently as possible. So that's, from my very limited, without too much detail about what's happening on the ground, that's what I can share.
Okay, well, thank you so much for your presentation today. You did a great job for your, I think this is your first time.
Yes, thank you.
Yeah, so
I appreciate it.
Thank you for coming and with the information and providing the information that you have presented today. We appreciate you, and thank you again.
Someone asked if Carol Osterberry, she is here.
Oh,
So
she is.
Yeah, she is.
Carol, did you want to give a few comments? Please state your name and title for the record. Carol, and I don't see her. Okay, so we'll come back around. She is able to join us.
She said, my internet connection just went off. She's trying to reconnect. So once she gets on, she'll text me.
All right. Well, thank you again, Ms. Baker, for attending the meeting today. All right. We are very interested in the public and what your views are. However, because we have quite a few comments, we will only have 1 minute. You will only have 1 minute to share with us your views. And if you emailed us, then we can read your comment. Or if you are on the Zoom call and would like to give your comments, we will do either or, but not both. So Madam Clerk, can you begin with our first person online that has a public comment?
Yes, the first hand was, it's or KNTOS D2001. The hand has been raised for a minute. Okay. Well,
Okay,
next is Cindy's.
Okay. Do you want to unmute everyone first? Maybe they're having a problem unmuting.
Okay, 1 second.
Okay.
Hello,
Okay,
can you hear me?
Okay.
Yes, we can.
Hi, thank you for unmuting me. I had a problem unmuting. I appreciate that. This is Daniela Cantos. So I want to talk about what happened in Alberta, Canada. A man went to court and won the lawsuit of no masks, testing, and vaccine mandates because the CDC could not produce an isolated COVID-19 virus. In fact, no one around the world has so far had any human beings be able to get a virus from them and isolate it. But we're going to take the taxpayers' money to promote COVID-19 vaccines that has killed more people than any so-called vaccine in 20 years in the first 4 months alone. More Americans are now unable to work and take care of themselves since the COVID shot. Over 13,000 deaths have died so far. And now you want to take money to give it to promote a vaccine that has failed drastically instead of helping the enormous amount of people that desperately need mental and drug help. How about promoting getting your vitamin D levels up above 80 per CDC for adults and children to talk to their doctors about supplements for optimum health to combat COVID-19? Most people die of COVID-19 due to vitamin D deficiency. Why aren't you taking the advice of the industrial hygienists for iWave air that kills all viruses and bacteria and mold in schools so we can get these masks off our children?
That's time.
Thank you. Next comment, please.
Cindy's iPhone.
Hi, everybody. I was just curious about the iWave air ionization units that they use in the hospitals that kill viruses. I've priced them out myself at Granger and other places, and they're about less than $1,000 per rooftop unit. And I don't understand why maybe some of the money that you're $300 million that Michigan's getting for COVID relief, why some of that money isn't used to put these units on top of the roofs of our schools so these children don't have to wear masks, because most of them can't get a vaccine, and they shouldn't get a vaccine because they're unsafe. That's all I have.
Thank you. Next public comment. And by the way, we don't go back and forth in public comment. We just want to hear what you have to say. Thank you. Next public comment.
Cindy, can I get your last name? Cindy, can I get your last name?
Weeblehouse.
Leicester, Mexico. Leicester, Mexico.
Yes, I'm here. I just want to say that I think it's ridiculous with your guys. You guys ain't sharing the correct numbers of the children that are infected. The government says that 0.1% of our children are hospitalized. So what, is Wayne County just a giant hot spot? That's all I have to say.
Thank you. Are there any other comments on the line, on Zoom? Any other public comments?
Amanda Wilson says she would like to speak. She's in the chat.
Okay. Ms. Wilson?
Yes, good afternoon. I just have to say that all the data that was presented today, not one piece of it supported the mask mandate for school-age children. Not one piece had anything to do with children from the ages of 4 to 18 in school that have to sit there for 8 hours a day in a mask, breathing in their own CO2 and bacteria. This is something that is really just very aggravating for parents to see their kids suffer day in and day out because somebody else decides that they would like to parent my children. Because when that mask mandate was done, That is exactly what the government decided to do. The health official, Carol Osterberry, who signed the mask mandate order, took my choice as a parent away from me and many, many others. This has to stop. I want to see hard proof and data.
That's time.
Next comment, please.
Shannon Seco.
Hi. Yes, Shannon Seco here. I just wanted to let you know that I'm very concerned with the kids with the mask mandates regarding side effects from wearing masks. I was in the doctor's office with my daughter today. She had to wear a mask in school, and she had terrible side effects, and she has impaired breathing. She has a condition, and they made her wear a mask all day in school. So the doctor is going to write her a note for it. But I'm very concerned with the side effects that these kids are having from these mask mandates in the schools, and no one is monitoring them to see if they are going to have any problems. She is having problems, and I had to take her to the doctors today. And yeah, just to let you know, I'm really concerned more about the side effects and these masks because they're not working.
Thank you. Next public comment.
Robin Schutz.
Is it Robin?
Hi.
Oh,
Hi.
Go right ahead.
Hi, I just wanted to say that, you know, we voted for choice on these mask mandates, and I agree with the previous speaker that I don't think that anybody's really paying attention to what the long-term effects are going to be with these kids and masks. You know, if you have a healthy kid in school or out on the playground or whatever, and there is no reason for the child to be masked. So if somebody is healthy, why are we masking these kids? And, you know, I believe I saw on a website that like CDC or even Wayne County, that there was like only one flu reported for last year. So are the tests picking up the flu? And so everybody, you know, so Wayne County is mandating masks for the flu and COVID. I don't think it's as bad as what everybody's blowing it up and making it seem. And I really wish that you would, you know, take it back and let it be parents' choice. Thank you.
Thank you. Next public comment. I'm sorry, next public comment. Did we mention, did you call a name?
Yes, Heather Fitzmeyer.
Hi, thank you so much for having me and for being willing to listen to all of us. I'm a mom of 3 young kids, and I just want to really encourage you to hear what a lot of us are saying, that, you know, given even what some people have mentioned about the lack of data, we can now compare, you know, countries in Europe that gave mass choice compared to other states with no difference in the hospitalization and death rate, that I would really encourage you to have that choice be made at the local level. I also wanted to point out, I thought a wonderful piece in The Atlantic by an epidemiologist, the downsides of masking young students are real. I thought it was one of the best pieces outlining the actual data that we have to look at. And the harms that exist are much more firmly established, at least at this point, than their benefits of mandating the mask. So I just really would encourage you to let this decision be made at the local, personal level, since, you know, it's our kids that are really the ones affected by these decisions. So thank you so much. And just please encourage you to really rethink the mandate.
Thank you. Next public comment.
iPhone.
All right, you broke up. Can you repeat the name, please?
Pam's iPhone.
Hi, this is in regards to the mask mandate. And just in saying that the school is not a medical setting, so it's not a setting for face coverings. In a school setting, they are dehumanizing, they're stifling, and nobody seems to mention how they are huge germ spreaders as the wearer is constantly touching and adjusting the same mask that is full of fluids and bacteria. We have 800 kids walking around the school, taking off the mask, putting on the mask, touching their faces. And that's exactly what we don't want them to do. We don't want them to be touching their faces. So, you know, beyond that, as far as the quarantining as well, they are quarantining kids who are not vaccinated, who've been exposed to the virus, yet vaccinated kids can go to school the next day. So when vaccinated people are transmitting and carrying the virus at an alarming rate and at the same rate as an unvaccinated person, nobody can give me any feedback.
Only when it's my turn.
It's time.
Okay.
Thank you. Next comment.
Megan Rockwood.
Hi. So I think a couple people have already covered a few of my points. I am just very saddened by the children being forced to wear a mask. We are punishing healthy individuals. We are teaching our kids that to be afraid, and not just to be afraid of, you know, possibly getting ill, but to be afraid of people that they are supposed to be in a trusting environment with. They're now being taught that they have to be afraid of their teacher, afraid of the other students. And I think that the negatives mentally, and even again with the bacteria and the germ spreading of the masks, are severely going to affect our kids in the long term. And that's not being taken into consideration. I also think that no one is seeing this from the perspective of the other person. So what if this was reversed and we were forcing kids that were scared not to wear masks? What if I told you who wants to wear a mask that it was illegal for you to wear a mask and that it's a mandate that you're not allowed to wear it? I think that there'd be very different reactions and we would all have a better understanding of everyone's choices. Thank you.
Thank you. Next comment, please.
Tamara Oliverio.
Hello, can you hear me?
Yes.
Great. Thank you for your time. I just wanted to talk about the mask mandates as well, but more in context of the rest of the agenda. As you probably know, being on the Health and Human Services Committee, mental health issues have been skyrocketing with Wayne County children and adults for that matter, but specifically children. And a lot of it is due to the effects of all things last year and this year related to COVID and other things. I highly encourage you to allow parents to have the choice in how best to protect their kids. You've heard from people on these calls in the past about attempted suicides, about hospitalization issues with children with mental health, and the resources within Wayne County are tremendously failing. So I highly encourage you as public health officials to put focus on fixing that and stop worrying about COVID and only COVID. Thank you.
Thank you. Next public comment.
Amanda.
Thank you. My comment is along the same lines about mental health. I am a person who was injured by the vaccine in March, and my child has watched me go from being a very active and able mom to being paralyzed in a wheelchair and still having no answers. And so when you talk about removing mental health services, which is something that I'm trying to get for not only myself, but for my family, it's really concerning because I don't know if any of you have actually tried to make a mental health appointment in our county, but it's extremely backed up. And sometimes the wait is 6 to 8 months. I don't have 6 to 8 months to wait. And so I really just want you to think about these things that are really affecting our kids and take that into consideration from their perspective and people that are trying to get help's perspective. Thank you.
Thank you. Next public comment, please.
Lacisha Walker.
Hi, it's Lacita, but I would like to say that I absolutely, unequivocally support the mask mandate. I just left out of a school where students were wearing them, some not wearing them properly. The ventilation wasn't too great in the building. I couldn't get out of there fast enough. Definitely, if we want to save lives and mitigate COVID, because it is real, I've had people, friends to pass away from it, friends to get sick from it, and friends who are still sick from it. It is serious. Yes, masks should be mandated because we want to protect your child and we want to protect other people as well. It's not just about that one person. It's about everybody, the entire community, the entire school, the teachers. It's about the students. It's about their peers and our colleagues. We want to mitigate COVID as much as possible. Therefore, masks need to be mandated.
Thank you. Next comment, please.
Heather Urbaniak. Heather Urbaniak.
Hello, yes, I'm speaking from a different point of view. I am the mother of 5 children living here in Wayne County. And quite a few years ago, I was a teacher in Hamtramck. And at that point, my doctor instructed me to wear a mask in order to protect my unborn child. It later came to light that that doctor was incorrect and practicing a form of medicine that put my life and my child's life in danger. And so I can tell you, during the 6 weeks that I wore the mask, my students suffered greatly. They became aggressive towards me, and the learning that they were able to have was limited. And then in the 6 weeks following, where I was able to show my face again after learning from my doctor, from a different doctor, the truth about what I was being put through. My students began to blossom once again, and they excelled, and their wonderful natures returned, and they became kind and gentle towards me once again. And I just want to share that with you. Thank you.
Thank you. Next comment. Uh-oh, you broke up.
Sarah?
Yes, thank
you. Can we get your last name, Sarah, please?
Beery, B-I-E-R-Y. My comment is regarding the mask mandates. I have yet to see data that supports the wearing of masks. Even on the box, it states there is no protection against airborne illnesses. I have seen plenty of data on the other side that is against wearing masks, including numerous points made in the chat here. And I would like to voice my concern, especially for our elementary students. Language skills are still being built up at that age by watching facial expressions and mouth movements for pronunciation from their teachers and from other children. And these children, I fear, will be delayed in those language skills and social skills. I would like Michigan, especially Wayne County, to be leading in education across the US. And at this rate, I believe, especially with these elementary students, that they will be behind. Thank you.
Mm-hmm. Thank you. Next comment.
There an 886 number is no name. 313-886.
Your number starts with the 886. If you'd like to speak, please unmute yourself.
Hello.
Go right ahead.
Can you hear me? Hi,
yes,
how are you? My name's Elizabeth Williamson, Williamson, and I am in agreement with all who have suggested and actually kind of demanded that our masking be optional. And I have 2 questions that I know you can't answer now, but I'm hoping you can answer later. The first is, and I've searched all over the website and cannot seem to find these answers. Can you explain under what statute or ordinance the Wayne County Health Department issued this mandate? And from what authority does this power come? I hope to get an answer to both of those questions. I thank you all for your time, and please, please consider allowing parents to make the choice about whether or not to mask their children. Thank you.
Thank you. Next comment.
Lynn, Ken. Lynn, Ken.
All right, Lynn, can you unmute yourself?
So sorry, I was trying. Thank
Okay.
you. Hi, I am calling today to discuss the masks. First of all, I would like to say that I think they should be optional. I would counter the previous comment about the person in favor of mandates and how she was afraid to be in the school. I think it's an awesome thing that she has available to her many masks. And if she's not comfortable with a single layer mask, maybe she could do a double layer mask, maybe triple or quadruple, whatever she feels is necessary. But the idea that she is afraid and nervous, I think should have no relevance about whether or not I mask my child. I would like to point out that there are many negatives to wearing masks, specifically social and emotionally. Young children, I have a 5-year-old and a 9-year-old. They cannot tell through a person's facial expressions whether or not you're sad or you're angry or you're upset. My son is learning phonics and learning how to read. I just ask that you maintain parental choice.
Thank you. Are there any more public comments online?
Billy Schultz.
Yes, I spoke to you guys about 2 weeks ago. I told you about my story of my personal experience with my daughter who attempted suicide due to the shutdowns and the masking and things being taken away. And when I got your agenda, it was very, very alarming to me that you guys are looking to cut 6 figures of mental health and behavioral in our youth programs. Our children need that. That's our future. Why are we cutting where we need it most? We need mental health programs and help now more than ever. We just heard the stats. There's no children that died in the last 7 months. No children died of COVID. But how many in the last 7 months died of suicide here in Wayne County? I would like that number. I know you guys said, you guys asked when she comes back to find out the deaths that occurred that weren't COVID. How many of those are suicide? We cannot take funds away from mental health.
Thank you. Any other public comments online? Any other public comments online? All right, you can mute everyone. And if you have public comments that were emailed in, please read those, Madam Clerk.
Okay. Can you all hear me?
Yes.
This is from Jamie, and the last name is WOJCIECHOWSKI. It says, "We the people and parents are demanding that you unmask our children. It is abuse. Health decisions about my child are mine, not the county, not the state, not the government. Unmask Wayne County children."
Madam Clerk?
Yes.
Before you go on, was that the end of that comment?
Yes.
Okay. How many emailed comments do we have?
A few. At least.
Okay, so let's do the emailed ones towards the end of the agenda. We have a couple of guests on the line. I don't want to monopolize their time today. So we'll do the emailed ones towards the end.
Okay.
All right, thank you. So we will go to the next item.
Item 2, presentation from Sherry Gay Dagnogo, Director of Outreach for Teen Wellness Center regarding foster care.
I think you're breaking up here. Sherry, did you want to go ahead and you can introduce yourself?
So thank you, Sherry Yogo, and just FYI, I'm trying to share my screen. So in order for me to share.
Okay, can you, Madam Clerk, allow her to share, please?
Yes, you can share it now.
Thank you. We'll go back to the top. Thank you again for this opportunity to present to your committee today, Commissioner Monique Baker McCormick, and to all the members of this committee. I am Sherry Yogo, and a former member of the House, current member of Detroit School Board, but today I'm coming to you on behalf of Teen Wellness Center, for which I am a Government Relations and Director of Academic Outreach. A lot of the emphasis today I've heard thus far with previous presenters and conversations is around mental health. And so I'm glad to be in this space now advocating for and highlighting the services that we provide at Teen Wellness Center. So just a background and a few of the things we'll talk about, because I know a lot of time has been spent. And I see one of our community stakeholders, Attorney Linda McGee, who's also going to speak from the Michigan Children's Law Center. And so she'll probably talk about some of the same things that we're working on collectively, addressing students who are aging out. So I'm going to go through this presentation somewhat fast to preserve time and allow for questions. But Teen Wellness Center is an organization that has been serving Southeastern Michigan since 2001. We are fully accredited and have been since 2003, initially specializing in mental health services, but driven to drive and serve the whole person. We have an integrated approach of providing services, mental health services, medical services, dental services, podiatry, and even more that we'll talk about as we move through this presentation. We've recognized the need to eradicate the negative impact and stigmas that exist for mental health services. And so we have many community partners that are supporting us in that work. I'm gonna go back a slide. We work with various groups, as I just highlighted, but we want to do more. And being a former Detroit public school teacher, I understand the importance of starting early and removing the stigma of mental health in urban communities and providing those services to not only our youth and our children who are in our school settings, but to the parents as well. I talked about briefly some of our community partners. We can't do this work by ourselves. We work very closely with a number of the organizations that you see here, including DWIN, Total Health Care, Meridian, Molina, and I'm naming a few, Teen Cares, nonprofit organizations, Detroit Public Schools, again, shameless plug, of which I am a Detroit School Board member, and many others, HAP and a number of other medical providers. And doing the work that we do to make sure that we're not reinventing the wheel, but we're working in a collaborative way to provide quality service throughout Wayne County. And we're doing that work collectively with many of the partners that are listed here today. Some mentioned and some that you have a chance to look at for yourself. We're doing this work, and the reason I'm excited about it, as many of you probably have seen, we've been advocating, and you see the bars on the side of this picture, but we're talking about the issues of social determinants and issues that we have of people who are impacted by poverty. But not only that, for many of our returning citizens. So after they come out of the bars or many of our jails and prisons, we want to make sure that we are providing services, mental health support services But as we know that Maslow's hierarchy of needs, we can't just say, get back to society, live like nothing never happened. So in addition to the mental health, we're addressing the education, the employability, the housing, the healthcare, and quality care, as we will talk about with the medical care that we provide, as these pictures show, as well as the dental care that we provide. Didn't have one for podiatry, but we provide those services as well. And so just knowing the background of the integrated model and the programming that we do, we have the psychiatry, the clinical therapy, case management fully around, nursing, peer supports, which is a phenomenal program. And I would like for all of our commission members who have not had an opportunity to tour with us as yet, to join me on a tour based on your schedule of availability, because we have some pretty amazing work going on. And to see people who have made it and navigated the challenges that they've had in their lives to now be able to extend a hand back or forward and bring somebody else along is what we see in our peer support services. Actually, as a legislator, I had an opportunity to tour Team Wellness on the Family, Children, and Seniors Committee. And so I fell in love with the model and saw that they had the full wraparound approach to providing services to children and their families throughout our community. We provide support for substance abuse services, as I highlighted, employment, housing, and our newest facility, I believe in Commissioner Glenn's community in Westland, is our women's residential inpatient substance abuse trauma center. I highlighted, as these blocks share, the psychiatry, our community action response team that is working with our law enforcement agencies, riding along with officers, making sure that we're able to diffuse situations where people sometimes are incarcerated. But if we have someone who is skilled and licensed and know how to diffuse situations that don't have to escalate into someone being locked away, we can take and provide services for those individuals and provide additional wraparound services so that they are able to re-enter society with the support, even if it's medicinal, to address their psychiatry needs or psychological needs. Primary care, dental, podiatry, and optometry. I had my glasses on for a minute, took them off. Sometimes I can see with them, sometimes I got to take them off. I talked about women in Westland. We also have a postpartum infusion therapy. As women who may have experienced postpartum depression, that has been typically kind of dismissed as not a real science. I heard Commissioner Colleen speak about his biology background, being a former teacher myself. I'm happy to support programming that addresses real medical needs for women. I talked about the supported employment services that we provide, academic vocational support as well, and all through partnership. I already lifted up the fact that we're fully accredited and we're providing these services as certified community behavioral health center. And again, fully accredited and have been since 2003. We're trying to break the cycle. For those who know about the cost of healthcare, and all of our commissioners on this committee certainly does, but all of our viewers, many of the costs that are associated with medical care is the fact that those who have been uninsured have utilized the emergency room as part of their medical care. And so we want to change that and help create efficacy and cost reduction, not only for those who can't afford health care, but for those of us who are sharing the burden of health care because it has to go somewhere. And so whether it's our Blue Cross or our HAP increasing as a result of these costs being transferred because of Medicaid, or our taxes increasing because of the cost impacting Medicaid. And so that's something that we're very proud of, that we are breaking the cycle by providing affordable care at our 5 campuses. And would love to show you all that on a tour based on your availability. The thing that I'm most excited about, and the reason that I was brought on board, though, as I've learned a whole lot about mental health and the services and integrated health model, but being a former teacher and understanding the impact of our students who are transitioning out of foster care, knowing that in Wayne County alone, more than 8,000 young people continue to age out. And we try to use the term children of care because many of them are not receiving that lifeline of support academically, behavioral health-wise. I had an opportunity to meet with the judges in the juvenile justice court, and the stories that I heard had me lamenting, how could we allow these gaps to exist in our system? And I'm very proud of the people, like I lifted up earlier, Linda McGee, who's on here, who've been an advocate for young people who are in the foster care system who need that support. But our goal of this program is not only to provide an academic partnership with our community colleges and or our skilled trade programs, whatever our children interests are related to, but also to make sure that they have somewhere to live. Most people don't know after they matriculate through the foster care system, many of them become homeless and they have nowhere to live. There's funding available for them. As a matter of fact, the ARP funds and the KP funds from the federal government are being programmed at the end of this month out of the legislature. And so we are pleading for collective support to make sure that these young people who would not have anywhere else to go, would not provide the support, provided the support that they need, but for these funds can receive these funds. And we're working aggressively with those who have been in the trenches for years during this work. I'm not going to go through the whole list of social determinants. This committee knows all about that. But that's the work that we're all about, is addressing these needs early. My background, again, being an educator, being a former legislator, now serving on the board, working with Teen Wellness, I'm very, very happy to connect with our civic community to make sure that we are collectively connecting the dots and not working in a siloed manner, but working together, bringing our best practices together and finding additional ways to collaborate. Whether it's the Aging Out program, which I have in blue, which is the program that I am most committed to. Not just that, we work also with our expungement and returning citizens community as well, being a proud member that was in the House that had a bill in the Clean Slate package that is addressing expungements. And so Teen Wellness is very involved in that work. And we can talk more about that at a later time. But the focus today is about providing the support necessary for mentoring, the collegiate, and as I highlighted, skilled trades bridge, the supported housing program is what we're seeking to do with the Aging Out program. I went through, again, relatively fast to preserve time and to maybe perhaps have a conversation, but we have the locations as you see on the screen. Eastern Market, on Russell, our Team East, Team Jefferson, as well as Southgate and Team West. Our president, Michael Hunter, and Elizabeth Teichin is our vice president. Again, I am the Government Relations and Director of Academic Outreach, and I would love to book a one-on-one conversation with our president and vice president and or invite you to a tour where you can see some of the work that we're doing firsthand. So Commissioner, Chairwoman, thank you for this opportunity to just share a brief overview of the work that I'm excited about with Teen Wellness. And if you allow for questions or have time, I certainly will avail myself.
Thank you. Thank you. I see you guys do great work. I didn't know the extent of what your organization did. So this was a great presentation and very, very timely. As you indicated, we do have issues right now with mental health challenges in Wayne County. Well, not just in Wayne County, but all over. So We're so happy that you joined us today. And at some later point, maybe we can all take a tour, and you
awesome.
can reach out to me to do that. We won't do the questions answer because this meeting is very long today.
I understand.
But thank you so much for joining us, and we're sorry about the extent of the meeting today. It's usually not this long, but
that's okay. I'm just happy to join you all, and thank you all for your dedication. I know it's a very hot issue, again, as a school board member, but thank you all for your diligence in the work that you're continuing to do throughout Wayne County.
And before you leave, speaking of school board, what is the views of mask mandates for the school board, Detroit School Board?
For the school board members, or for our, well, pretty much our district as a whole. That's what we have aligned ourselves with when students are on campus and parents or any other individual that enter our building. We are wearing the mask.
Okay, thank you. I just wanted to know where Detroit Public Schools stood. Thank you so much.
Thank you so much.
Thank you. Madam Clerk, next item, please.
Item 3, presentation from Linda D. McGee, Executive Director for Michigan Children's Law Center regarding foster care in Wayne County.
All right, Ms. McGee, are you here?
I am here. Can you see me?
Yes, we can now. Thank you so much. And if we can allow you about 10 minutes, and the same offer that I extended to Rep. Sherry, if we can come and maybe see what you do and how you do it, that would be great at another time. But go right ahead. Thank you so much for coming this evening, this afternoon.
No problem at all. I want to thank you for extending me and Representative Sherry Gay-Dagnago the opportunity to speak about this important issue. And just for those, I'm reading the comments, and just for those who are in the comments, we've been scheduled for over a month now to speak. But I'm going to try to abbreviate my time because I know this is a hot topic, and you want to give everybody an opportunity to speak about the mask and all of that. But I am moved emotionally about by the parents who are for mask mandate, who are against mask mandate, because they are parents who are advocating for their children. And the reason that I'm here is because I represent, as an attorney, I represent children who don't have that. I represent children who are in foster care, and more specifically, children who are aging out of foster care who don't have anyone to advocate for them like that, for whatever the position might be, for, against, whatever. And that's what I do. I advocate for these children. Representative Sherry Gay-Dagnago has partnered with Michigan Children's Law Center to do the same. I see my friend Derek Blackman on here, who has been advocating for children for a very long time. And I placed in the comments that I hope that everyone on here, the last count was 88. I'm sure some people have left by now, but I'm hoping that everybody who's advocating for their own children would take a moment to listen to what we have to say about advocating for other children, because Team Mental Health offers a lot of services for our clients in foster care. I am a co-executive director of Michigan Children's Law Center. We have 12 attorneys who go to court every day and fight for kids who cannot fight for themselves. We are the attorneys who go into court, and we tell the jurist, judge, referee, or whomever what it is that we think is in the best interest of children in foster care and on the juvenile justice side. We never know what our kids are doing. So you never know what children will end up being juvenile justice clients of mine, as I would call them, in Wayne County. That's where I work, and that's I'm before the Wayne County commissioners. And I just want to thank you all for inviting me here to talk about this delicate topic. just briefly, we've been doing this work since, I've been doing this work since 2007. Prior to that, I was a Detroit Public Schools teacher after college. And then I started a nonprofit called the Arc Nonviolence Program and went into the school system to teach young people, the ones who got suspended all the time and were in trouble and that nobody wanted to work with. I taught them how to pursue a career, how to go to college, all of that good stuff. And partners like Sherry Gay Dagnago and Derek Blackman helped me do that. We had partners all over the county. They helped us go into the school system and the community to teach young people how they could do better, despite their surroundings, despite their circumstances, their upbringing. It didn't matter. You can still be somebody. You can still be productive in the community. And some of you know what I'm talking about. But as of 2021, Michigan Children's Law Center has a specific focus on the aging out community. So I post a lot on Facebook. Please friend me, Linda McGee, or Michigan Children's Law Center on Facebook, because you'll see a lot of information about children in general who are in foster care, but specifically those who are aging out of the foster care system. And I think that's where Commissioner Tim Killeen saw some of my posts, and he also invited me to be a part of this conversation that I'm so happy to be a part of. Just a few facts about Michigan in particular. There are over 13,000 children in the foster care system right now. Over 900 of them will age out of foster care by the end of this year. So that's just a few months away. If you don't have any familiarity, some people in the comments are saying that they have fostered children, so they may know that if you are 14 years old when you come into foster care, or you come in and you turn 14 years old, there are some resources through Youth in Transition funds through the state of Michigan that would allow you to live with some resources. You don't have to kind of be out there in a foster home by yourself without driver's education being paid for, or college searches being paid for, your athletics are paid for. Youth in Transition funds help you fund the laptop and all of those things that our children need. The things that we pay for our kids, the state also has the funding for. In addition, once a child turns 16 years old, if they come into the foster care system or they become 16 while they're in foster care, they're eligible for independent living. Is a program that allows a child in someone's home. They just need a room. The person who has the home doesn't need a license to have this 16-year-old in there. The 16-year-old or older, 17, 18, 19, just needs a room. And generally, these are the more responsible, older children who are in foster care who can get to their own services like therapy or visits with their parents, things like that, or school or whatever the case may be. They're independent. And the foster parent or the home provider does not have a whole lot of responsibility like they would if they were younger than 16 years old. And then at 18 years old, the children can make a decision. They can decide, do I still want to remain in foster care, or do I want to continue, just cut loose from the court system? I don't need an LGAL. That's what I'm called, a lawyer guardian ad litem, who helps my clients and advocates for them. And as you know, as parents, a lot of our 18-year-old young people think that they are adults. Technically, they are adults, but they think they can do things on their own. They don't need you anymore. They know everything. What does my mom know? What does my dad know? I don't need a court system to help me navigate my way through life. And they cut the court loose. A lot of young people do that. They cut the court loose, not realizing that there are services that are available through the state of Michigan. So what happens if they decide, hey, maybe I'm not ready to cut the court loose? I do need my lawyer to advocate for me. I do need a social worker. I need to talk to my judge about things that may or may not be working for me. Then they go into a program called Young Voluntary Foster Care. So it's called YVAC. Those who choose to remain in the system go into a program, and they can stay in that program until they're 23 years old. But if they decide to stay in foster care, they age out at some point. It's either going to be 19 years old or 20 when the court just says, you are not going to be able to stay in foster care. We are not going to be able to help you any longer. So if they're not in YVAC, what happens to those kids? What happens to those young people who've been in foster care maybe 10 years, 5 years, 3 years, whatever the case may be, and now all of a sudden they're not in foster care and they don't have any support, they don't have any services, and I, as a lawyer, am not with them, the community is not supporting them. That population makes up a vast number of our young people who are in the criminal justice system. There was a recent statistic that said that 65% of children who age out of foster care without services end up in a criminal justice system. That's either on probation, they pick up some type of crime. So why am I here? Because I want to speak to you about these young people. I want to talk to you about how you as a community, those of you who are out there fighting for your own children who may take 5 minutes, a month or whatever to help some other children as well as your own children, you can help these kids. So I don't have a shared screen today. I do have some resources that I'm emailing, and anybody who is interested in receiving those resources, I will send them to you. What you can do immediately as commissioners is decide that no child in Wayne County, no child under my watch is going to age out of foster care without resources. They should have mentors. They should have trauma-informed therapy. That if necessary, they should have a job or career path. They should have a home, because a significant amount of foster children end up homeless, and that should not happen. They didn't ask to be in foster care. They were removed from their families because of neglect and most times poverty issues, and now they're homeless and living on the street or committing crimes because they need to eat. That should not happen in Wayne County. That shouldn't happen on our watch as professionals. Let's just say no, that's not going to happen. And if you're a community member, say no. I'm not going to allow children to end up on the streets when this is no fault of their own that they're a part of this system. The system is not perfect, but if all of us work together, like you're working together on communicating about a mask mandate or being against the mask mandate, you're working together. Then work together to help these children who are in foster care so that they don't age out into homelessness, teen pregnancy. Only 3% of them actually obtain a college degree. But guess what? There's $4,000, there used to be $4,000 a year. Now under Chafee, the new Chafee funds in Michigan, there's $12,000 a year available for young people who age out of foster care to go to a vocational school or a college. $12,000 a year to be able to obtain your college degree, and we only got 3% in Michigan? That doesn't make any sense. We should be helping them. They're 18, 19 years old. They don't know what to do, even though they say they do. So the most immediate ask that I have of you right now, so you can get back to your agenda, is to communicate with the legislator that you have. Representative Sherry Gay Dagnago has already pulled together legislators to help release $11.5 million from the federal government. Former President Donald Trump signed this bill to release this money to children who are in foster care and aging out of foster care. $11.5 million is available to these young people so that they won't age out right now, so that they will have resources available to them right now. But because of whatever is going on in our state with politics, the money hasn't been released. A lot of this money will be returned to the federal government on September 30th of 2021. This is September 7th. We don't have a lot of time. Contact your legislator. I'm going to send Monique Baker McCormick, Commissioner McCormick, I'm sorry, an email, or her assistant an email that hopefully can get distributed to anybody who is interested in signing on to a change.org petition to ask Governor Whitmer to release the funds. It's not on her desk yet, but we wanted to get there and then her to sign off immediately. so that the kids can get the help. They should not be, right now, the Shaky dollars will prevent them from aging out of foster care. They shouldn't be out here. These are pandemic dollars signed in 2020 so that they won't age out, but they've been aging out all year because the funds haven't been released to help them. So if you can contact your representative, I don't care if you're Democrat, Republican, Independent, it does not matter. These kids don't care. They just need the help, and the time is running out. So I just really appreciate you, Commissioner Baker McCormick, for allowing me to speak for these few moments. I know I can't take questions right now. You have a very full agenda. So these few minutes, I appreciate you taking. And I just want to remind everybody, this is not a political issue. We just need to help these young people.
Thank you, Attorney McGee, for your time on this very, very important issue. Can you state your email as well as, or your phone number? I know you're going to put it in the chat as well.
I will.
Yes, so that anyone can contact you. The people on the phone may not be able to see it. So if you can just state it very clearly for them.
Sure. I work in the Wayne County Juvenile Court, and our offices are closed right now. By the way, they do have a mask mandate for reopening. But my email for Michigan Children's Law Center is miclc.org. That's our website, miclc.org. My email is lawlinda.
You're breaking up. Can you start over?
AOL.com. That's my personal email. Lawlinda.
Can you start over one more time with your email, your personal email, because you broke up?
Oh, I'm sorry. It's lawlinda@aol.com, and Linda spelled with a Y. So it's LAWLYNDA@aol.com. And then our work email, well, you can, if you want to get in contact with me, just email me at that address and I'll get back with you.
And is there a phone number?
313-587-9762.
One more time, please.
313-587-9762. And I respond to text a little bit better. It's back to school season for our clients in foster care and the juvenile justice side. So we are doing a lot of we have an education advocacy unit that's making sure that our clients get their IEPs, individual education plans, and their backpacks and all of their school supplies. So right now we are a little busy. So I respond a little faster to text messages if you have any questions.
All right, thank you again. And I will let Commissioner, Vice Chair, Commissioner Tim Killeen, if you had some comments or wanted to address Ms. Attorney McGee as you reached out to her and invited her, if you had anything to share.
Real quickly, Madam Chair, and thank you for that. Ms. McGee, I was over at the Ennis Center a few years ago, and they were discussing how 25 years ago, for every kid they had in foster care, they had 10 or 12 families that expressed interest in adopting. But currently, that's about 2 families for every kid that's in foster care. Can you comment on that? Just in terms of being able to get these kids placed in families, or how are families stepping forward to say, I want to foster a kid?
There's a severe shortage right now of foster families. And I don't want to get too deep into the weeds about why. There are a lot of requirements that personally I feel are unnecessary. When children are homeless and they need a home, I don't think that it should matter if there's an exit window in the basement. That's, that's just me. But there's a severe shortage, but there are still families who are interested in fostering. There are multiple agencies out there who are amazing. Derek Blackman, he's on, as I've mentioned him probably 2 or 3 times. He works for Black Family Development. That's one of our partners. We partner with Ennis. We partner with Guidance Center. We partner with, most of the agencies are really good agencies who will take families through the foster care process. In the past, it wasn't easy to do things online. If you needed to do your classes that are required to become a foster parent, some of the agencies didn't allow you to do that online. But I think now in 2021, probably 90% of them are allowing. Well, now during COVID, they have to allow, the online presence to be able to do to get your foster care license. So we need all the foster parents we can get, specifically for children who are aging out. As I mentioned before, for independent living, all you need is a bedroom. You don't even need a license. You don't need a license. All you need is a bedroom. Of course, you don't want people, you don't want young people coming in any time of the day or night, bringing friends over, that kind of thing. So they are screened. The teenagers are screened before they come into the home, but it's a lot less cumbersome to become an independent living provider than it is to become a full-fledged foster parent. Additionally, there may be people on your Zoom today who have a family member who is interested in becoming licensed, and they don't need to be licensed. If you have a family member that's at risk of becoming a foster child or is in foster care, you can care for that family member, and you will the family member will receive the same stipend that a foster parent would without getting a license. There are certain criteria you have to meet. The home has to be screened. It has, we still got to make sure the kids are safe. I'm not a social worker, so I don't know all of the particulars about that, but I know the house has to be safe. And you can become a foster parent for a relative. There are a lot of these children have relatives who could take them. And over the past 4 years, the state system has allowed relatives to have a stipend that they didn't have before. Because, face it, raising children is expensive. As we know, it costs money. They eat.
Thank you, Madam Chair, for letting me step in on this. I just did want to bring out the fact that the number of people that are willing to take kids in foster care has dramatically decreased over the 25 years. So I just want that word out there and have the public understand that. And thank you for all you do, Ms. McGee. Thank you, Madam Chair.
Can I just say one more thing about that? I'm sorry, Vice President Colleen, can I just say one more thing about that? And Madam Chair?
Go right ahead.
If we could.
And by the way, what is the stipend?
I don't remember offhand what it is a day. Mr. Blackman probably could tell you exactly what it is a day. There's a range.
Okay.
That starts and kind of low, and then depending on what you have to do for the child, it increases and up to a level. The highest level I think is a 4, and that's for medically fragile children that you can't work. You have to take care of them 24 hours a day, or they need 24-hour day assistance. So that's the highest.
Do you know the range though? What would be a 4 versus a 1? Just the average.
It's significant, but I can get the numbers for you if you want to send it out.
Yes, I would. I think that always weighs in whether people can assist in these matters, because they want to know that they can afford to do so.
It doesn't pay well. I'm very frank, very upfront about that. It doesn't pay well, but it's enough to take care of the child's basic needs.
Right. Okay.
Yeah, very basic needs. But what I wanted to say was that if anybody was interested in becoming an independent living provider, the older youth run a great risk of becoming institutionalized, because if they don't have a foster home, and there are not enough, everybody wants a baby, and even the babies don't have homes. We haven't seen it this bad. I've been in this industry for 28 years. I've never seen it this bad. where the babies don't have homes. Everybody wants a baby, but the older kids, they are the least likely to be adopted or placed in a foster home, and they become institutionalized because they end up in residential placements if they can't find a foster home. And you'd be surprised, but 16 and 17-year-olds still want to get adopted. They want families. People want permanency. If for the 3% that do go to college, when they are out of school for the summer, Christmas, Easter, you know, all those breaks that our young people have when they're in school, they have nowhere to go. They want permanency. They want a place to go. They want a home. So just consider it. And if you are not able, there's always opportunities to provide luggage, back to school supplies, driver's training, assistance with practicing with your car. There are so many opportunities to help foster kids even without having them in your home.
All right. Thank you so much for your presentation and appearance today, Attorney McGee, because we don't want to leave any of our children behind. So yes, thank you again. And we have your information. We will definitely be in touch with you. Thank you.
Thank you. And keep up the good work.
Thank you. Madam Clerk, the next item.
Item 4, requesting commission approval of a 3-year intergovernmental agreement with the Board of Trustees of Michigan State University.
Is there a motion for approval?
Move approval, Madam Chair. Colleen.
I'll support.
It's been moved and supported. Any discussion? I believe we have someone that can talk to this very briefly. Briefly, please.
Yes, Commissioner. This is Richard Wooten. I'm the director, district director for Michigan State University Extension. I'll be very brief. We sent out annual reports about a month ago. We sent hard copies. Yes. I would suggest that you take the time to take a look at those. I just want to highlight some key differences that we made to those reports. We're doing comparison reports now where we compare from year to year. So if you looked at your report that we sent out, we did a comparison between 19 and 20. And what's interesting about those is that you're going to see those every year. The executive unit requires those reports from and those numbers from us every year. So we decided to put those in the annual report. So you'll see where our numbers go up, you'll see where our numbers go down, you'll see how they change. Quick comments, our numbers actually went up from 19 to 20. It's a good news, bad news story. The numbers actually went up because we went into virtual programming and we were able to provide programming from anywhere in the state of Michigan, which means that if you were a resident in Wayne County, you had an opportunity to participate in any extension programs that were offered anywhere. So our numbers actually went up by about 3,000, from about 55,000 to 59,000. Unfortunately, though, they fell through the floor in terms of youth development. There's been a lot of conversations about young people and working with youth. We generally work with about 19,000 youth a year. That number dropped to about 1,000 because of COVID. This is 2020. Volunteers average about 1,000. That dropped to about 40, to about 76. Our programs with limited income families that focus on nutrition education, especially working with the school systems, those numbers dropped dramatically. Although our general numbers in health and wellness went up. And we believe it's because people were looking for online activities around health and wellness because of the lockdown. We had a lot of people that participated in mindfulness programs. We had a lot of people that participated in our online Tai Chi programs, a lot of people that participated in stress management programs. So we had a lot of activities that were held online where people had an opportunity to actively participate, and those numbers went up. But unfortunately, for our limited income families and for our overall youth, our numbers dropped from 2019 to 2020. So, and another key difference we're going to make in those reports is that we're going to start documenting the partners that we work with on an annual basis. We put those in the 2020 report, and we're going to try to provide a robust list of all of the different programs that we can provide over the course of the year. We went to a new reporting system, and that new system will allow us to track that programming better. We haven't got to that point where we're tracking it by zip codes and districts that we discussed last year. We want to get closer to that. we can track it by county because we have to report to the federal government by county. But we still got a ways to go in terms of tracking it by zip codes. We're trying to get all of our programs across the entire state to be tracked by zip code. So we can tell you everybody from Wayne County who has participated in a program anywhere in the state. So there's kind of a good news, bad news story. If you've got any questions about that report, don't hesitate to reach out to me. We are like everybody else. We're trying to ease back into face-to-face programming. We're going to have some problems with our partners, especially those partners with the Detroit Public Schools, because they've got very strict mandates on how we can engage young people in those settings. And we're still trying to figure out if we can work through those challenges. But we are getting back out and doing some face-to-face programming. We're watching what's happening like everybody else. And we'll just track those numbers and see what happens.
Great, great. Well, I am a fan of your programs. I think they are reaching our communities and having an impact on, I know, at least my district. So I appreciate your programming. Commissioner Killeen, you had a question? Go right ahead.
Yeah, thank you very much, Madam Chair. And I think my question, I don't know from commission staff if Mr. Abbo or Ms. Carr is on the line. As I read this, it makes reference to $5,000 to the Wayne County Soil Conservation District, and this is a 3-year agreement. But I thought in the budget that we just passed for next year, there was a $25,000 item for the Wayne County Soil Conservation District to go to into the budget for co-op extension. So I want to clarify the 5,000 I see in front of me here and the 25,000 that I thought went through the budget last week.
Yeah, Commissioner, the contract you have now is the one that we had in place prior to the additional monies going to Soil Conservation District.
Oh.
I was told that the idea is that we would add that money to the contract in an amendment, like we did the last.
Oh, okay. So it's yet to come.
Yes.
And by the way, you do a great job, Mr. Wood. Love what you're doing over there. Thank you. That takes care of the question. Don't need to hear from commission staff. Thank you, Madam Chair. That's all I have.
Thank you, Commissioner Killeen. All right, so it's been moved and supported. All those in, I'm sorry, any other discussion? I don't see any other commissioners. Okay, all those in favor?
Aye.
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 Any opposed? Any abstentions?
Madam Chair?
Yes.
Does this require a roll call vote?
You know what? Let's do a roll call.
Yeah.
Although it doesn't, but we can. We'll do a roll call. All those in favor, let's do a roll call vote. Madam Clerk?
Commissioner Dobb?
Yes.
Commissioner Anderson?
Yes.
Commissioner Killeen?
Aye.
Chair Baker McCormick?
Yes. Any opposed? Any abstentions? All right, motion passed. Next items, we will take these care management organization items together. I think it's 5 through 8.
Yeah.
And
I'll move items 5 through 8 for approval, Madam Chair, but also take note that there's still one outstanding CMO that's not here today.
I'll support.
Duly noted. Okay. It's been moved and supported. Any discussion on these items? Number 5.
Yes, Madam Chair, I have a question.
Yes, go right ahead, Commissioner Dobb.
Thank you. So for these items, we're seeing an increase in funding on some of them and a decrease in funding on some of them. I'd just like an explanation on how it works with some of the organizations get an increase and some of them get a decrease.
And I believe we talked about that. It's due to the number of participants, but I'll let them go.
Administration could explain.
Elaborate.
I know we've got a lot of members from the public here, so just for an explanation. So
sure.
Why it's happening. Thank you.
Hi, this is Cecily Hoagland, Administrator in the Juvenile Youth Service Division. These are the quarterly adjustments. Let me see if I can get my video. Hi, so these are the quarterly adjustments. They're based on the actual days of care for the quarter. We send these adjustments to the CMOs and they agree with our numbers for the days of care for the quarter, and it's bringing the actual days of, so some will have an increase, some will have a decrease based on their actual days of care for the quarter, and they all net to like 0.
Okay, thank you. So we're not actually taking away funding from anyone who needs mental health care in Wayne County. Is that correct?
That's correct.
Okay.
They have a base budget.
But shifting around funding for where we need it, because these are all the care management organizations represent different areas in the county. Is that how it works?
Yes, they're based on zip code.
Right, okay. Okay, that's all I needed. Thank you so much, Cecily. Thank you, Madam Chair.
Thank you, Commissioner Dobb. All right, it's been moved and supported. Roll call.
Madam Chair, may I?
Oh, I'm sorry, Commissioner Killeen, go right ahead.
Okay, yeah, you got a lot to do when you're in that chair. I'd like to follow up real quickly with Ms. Hoagland. Given the pandemic, Ms. Hoagland, are we seeing a change in the mix of services that are being offered? Are some being used more than others these days? Some being used less? Can you comment on that from where you sit?
Well, I know sometimes you're seeing less families because of the COVID-19. Like our numbers are down from what it was a couple of years ago. I would have to check and see if more mental health services are being used, and I would suspect that they are, given that kids have been at home for a long time. So I can check and see if more mental health services are being used.
Well, I think that would be, kind of an important thing. It's all part of the public health crisis that we're having right now. So if you're able to pull out what services are up, what services are down, as a policymaker, I'd be real interested in that.
Okay, I can.
Thank you. Thank you, Madam Chair.
Thank you. And by the way, just for the public's information, we foresaw in this committee in March of 2020 that we would have an increased number of mental health cases. And so we sought at that time to ensure that we had the funding and the ability to service those in need. So we did,
I'm gonna print it out.
we were proactive on that and in this matter. So
I don't know.
Just wanted to ensure that the public knew that. So these items 5 through 8,
311, I think.
there was a motion for approval and it was supported. Madam Clerk, let's do a roll call vote.
You want me to call and tell them to do that?
Glenn, go on mute.
Commissioner Dodd?
Yes.
Commissioner Anderson?
Now he comes off.
Commissioner Anderson?
Yes.
Commissioner Killeen?
Aye.
Chair Baker McCormick?
Yes. Any one opposed? Any abstentions? If none, motion passed. Next item, please.
Item 9, requesting commission approval of a cooperative agreement with Brogan and Partners Advertising Consultancy.
Madam Chair, I'll move item 9 for approval. Colleen.
I'll support.
Okay, it's been moved and supported. Can we have someone from the administration talk about this item, please?
Hi, yes, this is Carol Osterbury, Health Officer, Public Health Director
Health, Human, and Veterans Services. And yes, this is for a, COVID-19 contact tracing, case investigation, vaccination, outreach, education campaign. And the funds will come from the state through a grant, and it will be multi-platform, as the social media, everything from Gas TV, Google, YouTube, and it will be throughout all of Wayne County.
All right, and this was not an emergency. Did this go out to bid? How did we decide on this vendor for this?
Right, through the procurement ordinance, and when we use the My Deal contractual agreement. So this actually is a company that has a contract with the state of Michigan for these same services. So that is why we're able to use them, and also knowing that they have the expertise for the advertising and all the platforms, especially for the COVID messaging that, needs to get out to the public.
Great, great. Any other commissioners, any questions? All right, if there are none, roll call vote, please.
Actually, Commissioner, before the roll call vote, this is Joe Slezak. It's going to have to be as amended because we have the incorrect business unit on here. So
No.
we're gonna have, nope.
No.
Sorry. Okay, nope, sorry. Never mind.
Okay, so it has been moved and supported, and all those, can we do a roll call vote, please?
Commissioner Dobb?
Yes.
Commissioner Anderson?
Yes.
Commissioner Killeen?
Aye.
Chair Baker McCormick?
Yes. Any opposed? Any abstentions? If none, motion passed. All right, next item.
F, such other matters as may be properly submitted before the committee.
There are no such other matters other than we do have a tentative meeting for anyone in the public that would like to attend. We will have a meeting next Tuesday, the 14th at 1:30, if anyone would like to attend. Next item.
Public comments.
All right, Madam Clerk, we will go back to the comments that were emailed to us.
Okay. Do you mind if I mute everyone while I read the comments?
Please do.
This is from Ashley Miller. It says, hello, I just wanted to send a sincere thank you for the Wayne County School mask policy issued last week. My two boys are in Plymouth Canton schools, and I was dreading sending them this fall. We did the virtual academy last year and elected to go in person before the Delta variant changed the outlook. I feel so much better about them. This is truly the best decision for our schools. And while I'm sure you will get a lot of negative feedback from those who view a mask mandate as a denial of freedom and a real inconvenience, I hope you hear from many families like ours who are incredibly thankful and relieved. Thank you so very much. This is from Joy Hudyma, Hudyma. It says, to whom it may concern, please for our children mandate universal, correct, consistent masking for our children. You as public health professionals have the responsibility to mandate the only mitigation factor public schools have. Leaving this important decision up to our local school boards full of real estate agents, financial planners, librarians, food service workers, etc. is not okay. Not one person on my local school board and I will argue not one qualified person on any local school board in Wayne County is qualified to make this decision. Please do what is right so that our children can go to our public schools as safe as possible. Thank you for your time and consideration. This is from Kate Walford. The Wayne County Health department needs to order an in-school mask mandate for children ages 3 and up until the COVID vaccine is widely available to all age groups. Please do not push this decision on volunteer school boards who are not public health experts. Some school board members who have followed the recommendations and voted for masking mandates are receiving threats from the anti-maskers. Please back them up. We need a blanket policy for the area with the arrival of the highly contagious Delta variant, not the current patchwork quote nonsense. My husband is a doctor and the medical profession is worn out. Please give them an easy assist. WCHD is derelict in its duty if it sits back and does nothing. You know the right thing to do. Thank you. This is from Jared Lawler. He says, hello, I am writing to express our deep concern over the current mask policy PCCS school system in Wayne County. As currently written, masks are strongly recommended for all grades. As parent of children under 12 who are not yet eligible to receive the vaccine, we are demanding that the policy be revised to require masks for faculty, students, and volunteers for the K through 5 grades. We hope you can see that this would be a reasonable accommodation that will still allow some flexibility in older kids. This is from Abu Isa Hiba. It says, hi, my name is Hiba Abu Isa, a local general pediatrician at Michigan Medicine Northville Health Center, a very concerned citizen, a mother of 3 children who are in school in Wayne County, all 3 under the age of 12 and therefore ineligible for vaccination. I'm emailing to implore you follow suit of Oakland County when they finally decided to make the right decision and also make the right, safe, responsible, and only reasonable choice and mandate universal masking for all Wayne County K-12 schools. When top governmental agencies and health agencies across the county are stating the importance of universal masking for all K-12, including CDC, MDHHS, AAP, it is your duty to set the precedent and keep children in your county safe. To not make a mask mandate is or turf it to individual school districts and create inconsistency and holes in our safety network is negligence. With increasing transmissibility of the Delta variant, increased breakthrough infections, and with over half of the students in your district ineligible for the vaccine, there's only one right choice. Please make the correct one. Put children first, keep them safe. This is from Kelly Taylor. It says, Dear Wayne County Health Department, I am writing to encourage you to enforce a mask mandate in our schools until all school-age children are eligible for a COVID-19 vaccine and our community spread is under control like Oakland County has wisely done. To me, this is purely a common sense issue. The only thing that has changed for children 11 and under from last school year is that there will be no virtual option, which will result in more children in the schools/classrooms. So why would we take away the only thing that protects the virus from spreading? We were told about the Swiss cheese method last year during the school board meetings to keep our kids safe. This year with no virtual option, teachers won't be able to use the layer of social distancing. Kids under 12 don't have the option to be vaccinated. This leaves masking as the only level of protection for our kids. Masking in schools is recommended by the CDC. CDC recommends universal indoor masking for all teachers, staff, students, and visitors K-12 schools, regardless of vaccination status. Was that the time?
Yes.
This is from Carol Resto. It says, to whom it may concern, I'm contacting you to voice my concerns about safe schools for staff and students. Currently, with the recommendations for returning safely, I do not see enough districts taking the recommendations seriously. It is disappointing that the educational institutions will only implement masking if the Wayne County Department of Health or MDHHS mandates masking. With the Delta variant of COVID-19 beginning to increase and the younger population becoming more affected, it is in the highest interest of the staff and students to wear masks and implement as many mitigation strategies as possible. You can help keep people healthy, safe, and avoid deaths by mandating masking and all other protocols to keep schools safe. This is from Lisa Whitmore. It says, to whom it may concern, please rebuke the mask mandate. Children are not at high risk for disease. It ultimately needs to be parent choice for this mask decision. This is from Rachel A.M. It says, I'm asking the commissioners to stand up and unmask our children. There's no science or data backing a countywide mask mandate for pre-K through 12th grade when there's only 12 pediatric cases currently hospitalized in the entire state of Michigan and 0 cases on ventilators. Last year, many schools remained open face-to-face all year long with only masking our younger children in the hallways and common areas. COVID was not spread nor transmitted by a student to any teacher in our school using these less restricted guidelines. Individual schools/districts were given the authority to make guidelines by Governor Whitmer, yet Wayne County Health Department once again overstepped. In addition, I'm asking that the commissioners demand an amendment to the order to allow smaller districts and minimal cases in private schools with minimal cases to proceed with the policies that they already had in place. Policies that worked and kept the emotional, mental, and physical well-being of our children in mind. This is from Aaron Stickle. It says, hi there, please consider to those of us who are for the option to have masks on our children in school. I will not bombard you with the evidence explaining how ineffective masks are for children in this email, but I certainly could. Just one big thing to point out would be the common sense issue that kids are touching their faces so much more frequently with them on than off. So much more. It is so hard to watch. I might be more inclined to believe that if the children wore N95 masks and never touched them, that they may stop the spread. However, you can't tell people that they have to wear a certain one in a certain way, just like you can't choose someone's dinner for them to try to make them more healthy. What has been more effective is the being reminded to wash your hands more frequently, better air circulation, and staying home when sick. Our private Christian school has been turned upside down. We have started the school year strong last week with no masks, only to be told late Sunday night that we have to wear them. This is devastating news for all of us who pay a lot. This is from Rebecca Carrier. To whom it may concern, we are extremely upset with the Wayne County Health Department's mandate for masks in schools. We are asking that you will allow the school districts to make their own determination regarding masks. We support the right of a parent to make the decision for their children. As a former teacher, I understand the importance of students being able to see their teacher's face as they learn, whether it be to see proper mouth shape during a phonics lesson or just to learn facial expressions and proper verbal cues. This is highly important for our children. Our son is on the road to overcoming sensory and anxiety issues. Wearing a mask causes regression and spikes his anxiety. This is detrimental to his health and his education. The Michigan Revised Code Act 451 of 1976 says, by law, any restraint that negatively impacts breathing cannot be applied to a child. We are imploring you to fight for our son and the Wayne County and the students in Wayne County. They deserve to have an option to attend school without a mask. This is from Kimberly Burns. It is with a heavy burden that I write as a Wayne County resident you this letter today. I'm a very troubled parent. Our son Joshua attends Plymouth Christian Academy, and a rising member of parents, we are completely against the health department violating our rights and forcing a mask mandate on our children. There's a vast evidence of ill effects masks have on our children. According to City Journal dated March 21st, 2021, researchers from the University of Witten-Herdecke in Germany established an online registry where they cataloged 18,000 parents who responded. More than half reported that their children were getting headaches from masks and making it difficult for them to concentrate. More than 1/3 cited other side effects: increased reluctance to want to go to school, unhappiness, malaise, impaired learning, drowsiness, and fatigue. After conserving those reports, as well as testimony from other researchers, a court in Weimar, Germany, recently ruled in favor of the parent. This is from Matt Rost, R-O-S-T. Please get rid of your mask mandate and let schools decide. Thank you. This is from Our Heaven on Earth. That's one word. Please consider giving parents the choice to mask or unmask their children depending on their family's needs. My kindergarten son has severe food allergies, and covering his face all day could hide signs of severe allergic reactions such as lip swelling or hives on face. Every second counts if he is needing EpiPen. I understand that there are parents who fear sending their child due to a virus, but it's not the only concern or fear, and therefore you're only catering to those who fear the virus. My son had a speech delay and worked extremely hard in speech therapy. I fear sending him with a mask will undo his hard work. Children need to see faces. Child expression, anxiety, and suicide has risen since the start of the pandemic. I understand the need to take precautions, but also realize some of the measures are creating bigger problems and greater risks. Children are not properly trained to wear masks all day. They do not have a specialist fit testing done for the proper mask. They aren't changing out their masks for a new clean mask throughout the day. It's just This is from Lisa Aponoves, Aponoves. I really don't understand the science behind kids forced to wear a mask all day long, sitting in school, but the minute they walk out of school, they're allowed to remove it and breathe freely for the rest of the day. Yet packed football games and students sitting body to body in the stands is okay on a Friday night, but make sure Monday morning at 8 a.m. you have your mask on because that's when COVID will strike. This is absolutely ridiculous, and you need to give parents the choice to send their kids with or without a mask. You know this has nothing to do with keeping kids safe and all about money and control. This is from Leah Riley. Good afternoon, commissioners. Regarding item 9 on the Committee for Health and Human Services agenda dated 9/7/2021, my name is Dr. Leah Riley, and I strongly oppose this misuse of my tax money on advertising for pharmaceutical companies. Grant money still comes from my tax dollars, and this advertising and public education campaign, COVID-19 vaccines and contact tracing, is an inappropriate use for that money. It is extremely frustrating to be on the receiving end of so much propaganda regarding the COVID-19 vaccines, and previous campaigns have been more political than educational in nature and lack access to the source data for the claims being made in those advertisements. Advertising the COVID-19 vaccines as the only treatment for the SARS-CoV-19 virus is inaccurate and misleading. Appropriating money for such misleading and inappropriate campaigns is a breach of public trust, violates informed consent, and will not be tolerated. This is from Val Effect. Thank you for continuing to show us that evil people exist and more prayers are needed. As human beings, God himself does not mandate we do anything. You are not above God. Although your orders does not say masking is required by the CDC, you are attempting to strong arm schools into making masking required. The CDC recommendations and guidelines for any measures being taken but been followed since the insert of this so-called pandemic. The category level we're considered at in this region does not state requiring masks in any of the CDC program. Stop the tyranny. This is from Jessica Spivey. To the members of the Wayne County Health and Human Services, since my previous email, see below forwarded for those of you who might not have had the opportunity to read it last week. I have had 2 personal friends who have tested positive for COVID. Both of those individuals are fully vaccinated, by the way, but that is a different conversation altogether. The reason I am writing you about this is that both individuals were informed by the health department that the HHS is no longer contract tracing COVID possible individuals, and that it is up to these individuals themselves to notify anyone they may have come in contact with prior to receiving their positive test. Imagine my surprise to learn that HHS does not feel it's important enough to contact trace and inform people that they may have been exposed to COVID. but it is important to mask up our children. This is especially curious when children have been proven not to be super spreaders and who have more than 99%. This is from Chayla Morelli. I'm appalled that the health department wants to unnecessarily mask up our children. This is only being done for control purposes as far as I can see. This is no science. There's no science that says children are super spreaders anywhere. This is borderline child abuse and strictly a control issue and to try to chip away at parents' rights. We are not under any emergencies. Less children have died from COVID the entire span it's been here with one flu season. Why is it always rules for but not for me? We don't co-parent with the government. This needs to be reassessed and removed. Thanks for your time and your help.
She also wrote some additional, and I'm going to read it through her time. I originally wrote this as a private message to help a friend gain clarity. I'm now sharing it publicly in the hopes that it helps others as well. It is often defiance and not compliance that leads to righteousness. Unfortunately, there are many people who believe that safety should override freedom. These individuals have good intentions. That's time. You can go ahead, Sherelle.
This is from Amelia Lee. To whom it may concern, as a follow-up to my previous note, I would like to further address the more recent and shocking development over the Labor Day weekend, by which I believe all the parents in Wayne County have been deeply troubled and infuriated. First, we understand that Commissioner David Kniezek went to the U of M football game on Saturday, September 4th, together with the other people, to be exact, shoulder to shoulder with no mask on, while at the same time, young children are mandated to wear masks in their classroom. We as parents are happy for Mr. Kniezek and the other people who live their lives normally, but our children have the same right, no more and no less than Mr. Kniezek. They deserve their normalcy and education. I am attaching a few pictures for a shocking visual effect in case the commissioners have not seen them. Secondly, I'd like to remind Commissioner Basham that we are still waiting for his public apology or resignation as a result of his utterly inappropriate behavior and obscene use of language. I quote, "Shut your pie hole and get a gun" during the most recent meeting. Be a man and own your mistake, or the consequences will be brought to you sooner than you thought. This is from Kirsten Kassab. Why is the CDC standard community standard for transmission of COVID appropriate for masking school children? As it takes into account the population of Detroit, what is the exact number of school children, both public and private, affected by the order? Around 300,000. What are the case numbers of school-age children of the sampling 2,400 tests per day? What percentage of these tests are routine? Can you prove children ages 4 through 11 are in danger of imminent death, but for masking? Why have you included school children ages 12 through 18 who are eligible for vaccination? Some school districts have high vaccination rates among these age groups. This is for Timothy Riley. Stop spending tax money on advertising for big pharmaceutical companies. Vote on item 9 on the Committee for Health and Human Services agenda for 9/7/2021. It is sick that the government is telling people what medical decisions they need to make between a patient and their doctor. Stop spending money to advertise or educate the public about vaccines for COVID-19. The vaccines that the public can get are not approved. If you want to educate the public, tell them that there are cheaper, safer, and actually effective options like ivermectin or hydroxychloroquine, two of the most safest drugs available. Ivermectin reduced the COVID-19 cases by 97% in Delhi. This is from Tamara Overby. It says, I have a 4th grade child. You all should be ashamed of yourselves with the mask mandates. Our children are in no more danger than they were pre-COVID-19, and you are using them for political pawns. In your metrics, why are children in elementary and high school grouped with adults over the age of 19 to 29. The masks are more dangerous than anything. Children are dealing with germ and bacteria infected masks, headaches, tummy aches, inability to breathe. You are denying our children of their God-given right to breathe fresh air. You will have to live with what you have done. How do you look at yourself in the mirror and sleep at night? This is absolutely disgusting behavior for adults. This is from Alyssa Schultz. Hi, my name is Alyssa, and I'm calling in as a parent of students in Wayne County. I'm asking that you please urge the health department to retract this unnecessary mandate. No one knows a child better than their own parents. The same data is available to each and every one of us. And I think it's unfair to tell your tax-paying citizens that you do not trust them well enough to parent and keep their own children healthy. Please leave it to the hands of the parents who have to care for their children after they have physically and mentally drained from wearing a restrictive breathing device all day. Masks are not one-size-fits-all solution. And that's all for the email public comments.
I have an additional one. This is from Unmask Our Kiddos. I am extremely concerned over the decision to decrease funding in the area of mental health and substance abuse. Number 8, only to increase spending on advertising and marketing public education campaign of the COVID-19 vaccine and contract tracing. Number 9, with the rise of stress and anxiety within our youth, we need every available opportunity for them to get the help they need. I do not think there is a person on this entire planet that needs to be educated on COVID-19 and the vaccine, especially not by advertising and marketing. That is a health matter to be discussed between the patient and their doctor. There is enough advertising on TV and radio now in regards to Big Pharma. The money can be better spent. Also, unmask our kids. Ray Basham needs to resign. I was on the Zoom call this afternoon and a question was raised about the data pertaining to kids and COVID. It was stated that the information had not been attained prior to the meeting. I am providing it to you in these documents I have attached. I hope that this helps you to make the right decision on removal. That's it. That's all the comments, Madam Chair.
All right, thank you both. I know that was very lengthy, but we always want to hear what the public has to say. And again, we don't really go back and forth, but we do consider all of the comments that we hear and we heard today. So thank you all for your comments. And next item, Madam Clerk.
Adjournment.
Is there a motion?
Move to adjourn.
I'll support that, Madam Chair.
All right. Well, thank you so much. You all have a blessed day. Thank you.
You too, Madam Chair.
All right.